Erythema nodosum is an example of panniculitis. That is the first thing that you need to understand. What is meant by panniculitis? Panniculitis basically means it's an inflammation of the subcutaneous fat tissue or adipose tissue. What is basically meaning of this? It basically means there is a inflammation occurring beneath the skin. Beneath the skin, we know there is epidermis. In the skin there is a dermis, and beneath the dermis there is a fat layer, adipose tissue layer. Now inflammation of this adipose tissue layer just beneath the skin, it is called panniculitis. And there are many examples of panniculitis, but erythema nodosum is a classic example of panniculitis. That is the first concept that you need to master. Now, what are the causes of erythema nodosum? Rather than memorizing, if you understand that there are certain triggers for inflammation, because erythema nodosum is basically an inflammatory disorder involving the fat tissue underlying the skin. So, what are the common triggers for inflammation? It could be a microorganism like bacteria, virus, fungus. It could be a drug. It could be immunological disorder. It could be a cancer. All these things can trigger inflammation. Now, if you apply that concept, now I usually, when I teach this thing, I usually tell the causes of erythema nodosum are A, B, C, D. A stands for autoimmune disorder. Certain autoimmune disorders like Behçet disease, also Crohn disease, and sometimes ulcerative colitis, but Crohn disease more commonly, and also sarcoidosis. These immunological mediated disorders, they can present with erythema nodosum. So number 1, A is for autoimmune disorder. Number 2, B is for bacterial infection. Now, viral infection can also cause like infectious mononucleosis. Fungal infections like histoplasmosis, coccidioidomycosis, they can cause also. But the most common infectious cause for erythema nodosum is streptococcal infection. Other bacteria can also cause this. What are the other bacteria? Like diseases, like it could be tuberculosis, it could be leprosy, it could be cat scratch disease, it could be psittacosis, it could be brucellosis. There are so many examples are there, but the most common infectious cause, most common bacterial cause is streptococcal infection. So we finished A for autoimmune disorders, B for bacterial infection. Now we come to the C. C means cancer. Certain cancers can also present with erythema nodosum. What are those cancers? It is particularly lymphomas like Hodgkin lymphoma. It can be due to leukemia like AML, acute myeloid leukemia. It's also due to certain carcinomas like pancreatic carcinoma. So C is for cancers. Lastly, we come to D. D is for drugs. Drugs can commonly cause erythema nodosum. What are the drugs? Oral contraceptive pills, penicillin, sulfonamide. These are the usual culprits which can cause. Other than this A, B, C, D, plus another thing you need to remember as a cause for erythema nodosum is pregnancy. So A, B, C, D, pregnancy. Lastly, how do we diagnose this? Well, diagnosis is mostly clinical based on this presentation over the scenes with red colored nodules, reddish nodules, which is painful. Sometimes when it is atypical, we need to go for biopsy, and biopsy classical feature we see is again panniculitis, septal panniculitis. So these are the 3 key concepts that you need to keep in mind about erythema nodosum. What are the 3 things? Number 1, it is an example of a group of disorder called panniculitis. Itis means inflammation. Inflammation of what? Inflammation of the subcutaneous, beneath the skin, fat tissue, adipose tissue. Number 2, what are the causes? Causes are A for autoimmune disorders, B for bacterial infections. Can it be due to viral infection? Can it be due to fungal? Yes, but mostly due to bacterial infection, particularly streptococcal infection. C is for cancers like Hodgkin lymphoma, like AML, leukemia, like pancreatic carcinoma. And D is for drugs like oral contraceptive pills, penicillin, and plus also another cause is pregnancy. And mostly it's a self-limiting disorder. So biopsy is not necessary. If biopsy is done, atypical cases, to make a diagnosis, will be getting septal panniculitis. So these are the 3 concepts that you need to master the whole thing, actually the key area about the erythema nodosum. Thank you so much.